Beard. I work in the ICU at the Orange Park Medical Center. And for my art presentation, I will be reading two short poems that I wrote. The second one's a humorous poem. It's a funny one. Um, a little introduction about the two poems I wrote. The following two poems are representative of the various types of patients I've taken care of as a nurse. These poems capture my emotions and the challenges faced when at work. They highlight a code of ethics that we as nurses strive to maintain during rough times, as well as the caring relationships we try to establish with our patients, and how we make a powerful impact on these patients and their families as well. The first poem pertains to nursing during the days we have when we feel broken, as if nothing we do matters, when things are out of control and we feel like things are our fault. It talks about how we overlook the good things we do and how they affect our patients and their families. The good things that we do that we overlook, I'm speaking of. And also our actions and words and how they are powerful and important. And we should realize that as we truly make a difference in the lives of the patients as well as their families, even though we may feel powerless at times. The second poem is the funny poem, and it contrasts the types of patients we take care of, and how despite what we do, and or how despite what they do, we strive to treat them with respect as well as equality, even if they may irritate us from time to time. Looking at meta paradigms, the two poems represent nursing by reflecting on the care and skills that we as nurses provide to our patients. Health is discussed to be non-discriminatory in the second poem, which with humor addresses difficulty with patients under our care while still having honest intentions and nursing them back to good health. Person is reflected through the various types of patients we strive to assist, including families as well. The various types of people we meet are discussed in the second poem. Both poems elicit imagery of the type of environmental settings depending on the types of patients we are dealing with. The internal environment of nurses as well as patients is expressed through times of sorrow, lowness, and irritation amongst both parties, us and patients and their families alike. So I'm going to read the first poem, and it's called Shine Bright. The pledge that we recite, after lack of sleep on countless nights, let Nightingale's actions shine a light. The care that we as nurses strive to provide, the tears and emotions we try to hide, the blessings we are in our patients' lives. Let the nurses realize we are the light. The empathy and compassion that we share when patients and families feel that no one cares. This time of darkness is where we stand to shine our light. And the second poem is Living Them with Kindness. It doesn't matter if you are rich or poor, black or white, we will care for you. A substance abuse counselor or a substance abuser, we will treat your wounds just as we would any other. A patient with kind-hearted words or patient giving the bird, we will still feed you and get you a warm blanket. You may try to punch staff, for which you will be restrained, or you may be fully satisfied with your care and never complain. We will discharge you both the same, with a smile on our face. Thank you.
Where's the